He's John Timpane.
And he's Don Rooney.
And this is
The Musical Innertube.
Now you may ask, why is this podcast called The Musical Innertube?
And we may reply, because that's its name, of course.
Now, how did this podcast get that name?
Back in college, we hosted a radio show. Once, we tried to introduce a soothing musical interlude.
Instead, we messed up and wound up introducing a soothing musical innertube, and the name stuck.
So here we are, hundreds of years later, still talking
to interesting people about their interesting lives.
Difference makers who really make a difference. Art Caplan is the Doctors William F. and Virginia Connolly Mitty Professor and founding head of the Division of Medical Ethics at NYU Grossman School of Medicine in New York City. And before that, Art was the Kaplan Professor of Bioethics at the University of Pennsylvania Perelman School of Medicine in Philadelphia, where he created the Center for Bioethics and the Department of Medical Ethics, where Art and I got to know each other. Welcome back to the Musical Innertube, Art.
Hey, thank you so much for having me back.
You've been doing some work abroad, and I'd love to hear what that was about.
I have a project that I'm doing with a country, the United Arab Emirates. And I know it can be confusing looking around the Middle East. This is not where the World Cup was. That was Qatar. And it's not Bahrain. And it's not Kuwait. It's right on the tip of the Arabian Peninsula, right next to Saudi Arabia, with whom they are fairly closely allied. They have cultural connections to the Saudis. They're their friends. You could look from the two big cities, Abu Dhabi and Dubai, across a very narrow strait and see Iran, who is not their friend. It's part of the reason they like the United States. They want protection, the Iranians. That's what's really going on. And before I tell you what I was doing there, I will tell you that your oil and gas money has achieved very much. There are modern cities with every amenity ever imagined by anybody. Architects gone nuts building crazy buildings. The tallest building in the world, the Burj Khalifa, twice the Empire State Building, is in Dubai.
Oh my God. Free
healthcare, free education. I don't know. If there's something that the state has to give you, it's free. So that's us. We bought a lot of that with our gas and oil purchases. Thank you, Exxon. It was great. They're living very well over there. In fact, one of the problems they face is obesity because they take the food and they drive everywhere, and it's a very lifestyle-driven problem like it is in the U.S. or the U.K. It's kind of ironic to see. The project itself was this. They are expanding their healthcare system very, very quickly, partly for internal use by people in the country, and partly to attract medical tourists, because they know that the days of oil and gas are limited, if only because there's a limited supply of the ground. But, you know, we are making efforts to reduce consumption, and they're aware of that, and they don't see their future being one in which they make big oil and gas profits. But they've saved a lot of money, and so they are investing in medicine and science, basically, to try and make those part of their economic future, part of their economic driver. I mean, they have other plans to do other things to build up industry there, but medicine and science are big. So in the country, already present are the Cleveland Clinic and the Mayo Clinic. They're both running hospitals there, and there are doctors, nurses living there who take the assignment. There are a number of fancy hospitals there from the UK. And what the government wanted me and my team from NYU to do is help them write a guidebook on medical ethics. They don't have any regulations at all about what to do with patient care. They asked NYU and myself to develop a guidebook for the government to try and deal with, let's call it emerging medical ethics problems that they are going to face or beginning to face because of this big expansion in healthcare. They're also advertising all over the Middle East, Eastern Europe, India, Pakistan, for rich people to come there and get care. So they're looking for commuters, if you will, to, show up, get your gallbladder fixed here, get a transplant here, get whatever it might be, get a physical even, because we are going to be world-class healthcare providers. So this is all pretty interesting to watch. It is a Muslim country, Sunni Muslim, but as progressive as they come, which means the women are not covered. Women are in leadership positions there. I think their biggest moral flaw is that they're not tolerant of LGBTQ individuals. It's against the law to be gay, if you will. And that is a problem. And it's going to be a problem, by the way, for their tourism things. But anyway, that's what that is. It's male-dominated. I mean, if you go, women don't speak in a meeting until the men have had a chance, the higher up, so to speak. But the culture wasn't so distorted that I felt we couldn't work with them. So a couple of things. What are their big problems? One of their big problems is they are mounting for the first time an organ donation campaign. So if you're going to do transplants, eat parts. And they have used living people to donate kidneys. They need to be aware that sometimes people pay poor people to do that and exploit them and don't take care of them. So we tried to say there's nothing wrong with an honest living kidney donor. We do it here. But you've got to really set up a procedure to require that you interview the potential donor, make sure they're doing it freely, they're not being coerced, they're not being paid as best you can. I mean, is it possible to fool doctors? Yes, but you try very hard to discourage that. And in terms of cadaver donation, they are advertising on billboards and so on. And what they're pushing is it's good to do this because you should be responsible to your community, responsible to your neighbor. It's a kind of rhetoric that I hadn't seen at all, say, in COVID in the U.S. You have a lot of this individualism and it's up to me to do what I want. And they're trying to push, and I think appropriately, a kind of duty to donate your organs when you die based upon helping your neighbor and your fellow kinsman. That's interesting. One other interesting thing about there are only 1 million, shall we call them Abu Dhabians or Dubaians or United Arab Emirates people. There are probably another 5 million guest workers there, built these buildings and so on. They want to involve them in organ donation too. One of the things that will require that is that they be willing to pay for transplants if those people need organs. So we were talking a lot about reciprocity. Mm-hmm. It's hard to go ask somebody from Indonesia who's living in a dormitory building the next big skyscraper to think about organ donation if they know they're not going to get a transplant should they need one. So that sort of issue came up. We were pushing them hard on that. Other things, they're going to probably offer a lot of in vitro fertilization and reproductive technology. Why? Because it's lucrative. It's a very lucrative business. That means, again, got to see who's going to donate eggs. What are they going to do about the children that result? Will they recognize them as citizens? Do they get all the benefits? What if there's an anonymous donor? Is that going to be a problem in their culture that they won't know who the father is, say at a sperm bank or something like that? So we were working in that area. I wouldn't say it's the world's number one problem, but it's it's why it's expanded in the U.S. a lot too. It's not our biggest healthcare problem, but you make a lot of money doing in vitro fertilization and reproductive tech. One other thing I'll mention, that is they have the old issue of if your heart is being maintained on a machine, then you're not technically dead. So we were trying to introduce brain death to them and trying to talk about the idea that providing care to an individual who is pronounced dead, a family might ask for that, but the state should never be paying for it. And the hospital should be allowed to transfer such a person, say, to a nursing home or even into home care. I mean, I think it is futile, pointless, and a waste of resources to do it at all, but we were trying to wean them gently toward the idea that, even if you shut off a machine, if you've already declared somebody dead, they're dead, and it's not harmful or abandoning your loved one to do that. So it was really interesting. We're going back in October, doing some more work in different areas. I think informed consent will be coming up next. I'm going to try and do that. Although, again, in that culture, probably in a family, the senior man is going to make the decision. There's still.
Can I ask? I have all sorts of questions about this, Art. So medical tourism, as I understand it, is when I decide to go to another country to get medical care that I can't get or won't get in my country, and I'm paying those givers of healthcare in that country. Am I correct? This would be,
and you pay premium prices,
right? So this would be really very wealthy people who had the dime for it. Am I correct?
Correct.
Okay. And I imagine there's some ethics about that, but I'm not exactly sure what they are. I just think that means that really rich people, if they want to get care, it's probably true now. I mean, they just go wherever they want and pay top dollar.
So 2 points about that. Rich people do go wherever they want and pay top dollar. If you went down the street where you are, John, to Children's Hospital of Philadelphia, you would find rich people from overseas getting care there for their kids because they know that's a very good children's hospital.
Yeah.
So it's not a new idea. I don't know that any of us are going to be totally shocked to find out that the rich do better than everybody else when it comes to anything, but they do in healthcare as well. The question for us is, can you manage that without letting the rich people coming tip over what's available to everybody else in the country? That is to say, if I show up as the sheik of somewhere to get, I don't know, some surgery, and I say, well, I'm going to take over the top 2 floors of this hospital, throw everybody out, because I got my chef, and I got my security. And
right.
I don't know, whatever I got. My entertainment is here. My singer is here. I think that's just wrong because it's distorting what you have for others. So we were debating about that and at least pointing out to them that justice says you don't penalize your own citizens in pursuit of this lucrative medical tourism trade. And then the other thing they're going to have to wrestle with is they do have free healthcare, but will it be healthcare that's available at the best places, or are they going to slide their own citizens over to the less fancy joints? Let's put it that way.
That was my other question: is if money bags from all over the world get to elbow their way into line, where and when and how long is the wait for people who are born there and have the right by birth of free healthcare? Do they have to wait forever? Do they go to 4th rank hospitals, or do they get excellent care? My
answer would be right now it's the 3rd and 4th rate hospital shift. It's not nothing, and they're not really queued up, but that's because they're building capacity very fast. That could shift if these money bags people really showed up in huge numbers. And remember, as much as we think of India, Pakistan, Indonesia as having many, many poor people, India, I think, has something like what was the number? It was like a million billionaires or so. I mean, there's a lot of money in these places too.
Oh, yeah.
It's not a small business. And one other thing I forgot. In order to staff these hospitals, they're going to steal healthcare workers from other countries.
Well, of course they are. If I'm a nurse,
yes,
I can make 10 times the amount. And I've heard about this before. I know that there's a certain number of U.S. trained nurses working in Saudi, for example. They have they face all sorts of problems, especially the female nurses, for obvious reasons.
Yeah.
But they're getting paid astounding amounts, and a lot of them say, well, the heck with it. I'll probably settle here for my working life. And then when I have enough of a nut set up, I'll settle back in the United States. So I imagine that if your clients here set up this what can I tell you? Like, set up this staffing utopia where they pay top dollar for everyone. There might be a service strain.
Yes. I think there will be. They're looking, where are they coming from? Countries in Africa like Ghana, which are advanced enough to produce some pretty good docs and nurses.
Oh, yeah.
They triple, quadruple the rate if you move to Abu Dhabi or Dubai, Philippines. I think all of the nurses are coming out of there to work overseas. Some here, by the way. What am I going to say? You can't make that money. You can't, go get paid 4 times as much. It's, we're all free marketeers, entrepreneurial capitalists of the West. I don't say because you're an IT engineer, you can't go work at some super duper Silicon Valley place. You should stay in Philadelphia and build sewers for the city. I mean, we're kind of, you get what you want to get paid, as our sports athletes show us. And it's
sure
against somebody's right to go make what they can make. Now, one thing to do is say we got to build some nursing schools, or we got to build some more physician assistant programs inside the UAE to start training more people to do all this. But that's 20 years out before you really see a difference. I think we can set them on that course, but there's going to be a period, there's going to be a brain drain.
We'll return to our podcast in just a moment, but first, here is a soothing musical interlude.
Art Caplan is the Drs. William F. and Virginia Connolly Mitty Professor and founding head of the Division of Medical Ethics at the NYU Grossman School of Medicine in New York City. Before that, Art was the Caplan Professor of Bioethics at the University of Pennsylvania Perelman School of Medicine in Philadelphia, where he created the Center for Bioethics and the Department of Medical Ethics.
Art is the author of 35 books and 800 papers in peer-reviewed journals. His books include Vaccination Ethics and Policy, The Ethics of Sport, and The Case of Terry Schiavo, Ethics at the End of Life.
To learn more, see his page on the NYU Medical Faculty website, med.nyu.edu/faculty/Arthur-L-Caplan. And now, back to the musical Innertube, already in progress. You've been talking over the last couple of months on various media outlets about the problems we have here, especially in relation to COVID. For example, you were on Boston Public Radio back in December talking about the fact that conservative parts of the country were more likely to experience higher levels of illness and death from COVID. And you especially honed in on what Florida is doing. So you want to talk a little bit about that?
Well, if you look at a map of the U.S. where COVID deaths and COVID outbreaks occur, it's red state, blue state. There might be a teeny exception one place or the other, but it's pretty much a lot more folks dying in red states. And one of the ones where a lot more people have died is Florida. And Florida, from a public health point of view, is a huge outlier because their governor, DeSantis, potential presidential candidate, has decided to run on a freedom and liberty platform. I think he calls Florida the new free state, which, by the way, the last time I heard that, I think was the Boers in South Africa. And
yeah, exactly.
But okay. Anyway, so he's appointed a surgeon general who is kind of a lapdog, and they run around saying you don't need vaccines, and we're going to ban any type of vaccine mandates, which, a lot of people have had heartburn about vaccine mandates, but you certainly don't want to prohibit them, let's say, in nursing homes where huge numbers of people are at risk. I might argue for some mandates in crowded venues, whether they're airplanes or concert halls or things like that. But anyway, they've already said they prohibit that. They don't like any kids getting vaccinated. I'm afraid that they're going to extend it to anything, meaning past COVID to mumps and polio. And then, worse, even if it's possible, they have not used any boosters. So there's a lot of folks who only get one shot, and that accounts for the, forget about the 5 shots. They're not pushing things. So, and he's all over the place. He's part of this, let's put Fauci on trial, and the Chinese deliberately attacked us with this virus, which, if it's true, he and I would be the last to know. I mean, it's not something that he has any insight into. Not that I do either, but it's just horrible. And what he's doing is setting us up for problems in the future with future outbreaks, whether it's COVID, if it came back nasty, or some other cuckoo disease of some sort. So I really think it's unethical, and I think he ought to be getting more criticism from political people now. But I don't know, you guys are a little more into the political expertise than me, but I think he's got a pretty good chance to be a serious presidential candidate.
Yes, well, he does. I think the Trump comeback has sort of lost a lot of oomph. So obviously they're looking around. They're thinking, well, who can we get to run?
Yeah.
It's interesting. I have to say, I don't want to knock anybody on this show, but I think that the Surgeon General of Florida has had some of the most bizarre public statements I've ever heard from a Harvard-educated medical person in my life.
And by the way, you'll like this, John. I did spend 1 year advanced training at NYU, but go on.
So you knew him then?
I did.
Great. Yeah.
I did.
I have to ask, he must know on some level that a lot of what he's saying goes against his training. And but it also means that it's contributing to Florida being a dirty, sick state. And that's not a term of opprobrium. I'm just saying it's not as clean and it's not as healthy as other states because of these policies, and it politicizes healthcare, which we've talked to you before on this show about. It's the last thing in the world you want to politicize, because it's about people and their welfare, and you don't want to make that their physical well-being, and you don't want to make that a shuttlecock for political debate. But that's precisely what it has done. It just seems highly bizarre. I don't want you to comment on another person's conscience, but it has been really shocking to hear some of the pronouncements out of Florida.
Yeah, there was a group I'm blocking their name, but they issued a statement basically saying, let COVID rip, let people get natural immunity, and that's the answer to this, not trying to mask and quarantine and isolate and vaccinate and so on. And he was in that group, so he bought that line of thinking that natural immunity is going to be the answer to this. I would urge him to take a look at China right now, where things are allowed to rip and not a happy picture. But, I would say this. He's not really a public health guy. He's not really a vaccinologist or some kind of virologist or something like that. He's not expert, in other words, in the subfields of infectious disease. But he is convinced, and has been convinced, that these other measures are not necessary. You just take your hit and then you move on. But what's wrong with that view? Partly it's because when you take your hit, you really get clocked among the elderly. They just die. That's what's going on in China. You just get terrible death rates. So if you want to write off the elderly morally, you probably could take the hit and have younger people survive COVID. But then, as we all know, the virus mutates. So even if it rips through, well, then that's just another opportunity to get a nastier version, or a more contagious version. It doesn't make it go away.
Right.
So I never understood the theory.
Do we have any sort of numbers out of Florida as to whether or not older people are dropping off more?
Yeah, we do. I don't know the exact ones, but they are they got hit much harder. Although, to be fair, in the earliest stages of COVID, probably the state that did the worst was New York under more liberal Cuomo, but he also didn't respond to the nursing home outbreak quickly. So I think that was poor policy on his part.
Yeah, well, I know here in Pennsylvania, that was one of the criticisms of Governor Wolf, the outgoing governor, is that he also did a lot of, shutdowns of businesses, shutdowns of schools, but he didn't really move fast enough on nursing homes.
Right.
That seems to have been the trend all throughout the country now, is that nursing homes, and still to this day, seem to have, I guess because they're private entities, they seem to have like a golden touch. They walk through all sorts of government regulation and that sort of thing.
I'll tell you what the problem is, although I want to proceed this. Every once in a while I ask, say I do a talk at a church or some adult assemblage of people, and I say, would you rather spend a year in a federal prison or a year in a nursing home? Everybody votes for the prison. So it's not exactly the happiest environment ever created in the United States. They're kind of forgotten, shuffled off, neglected. We kind of pay attention when there's a disease outbreak or some scandal takes place. Otherwise, nobody remembers them. And everybody I know, literally everybody I know, tries their best to keep their loved one out of them, which tells you, and I, my own grandma, many years ago, went to a very good nursing home. It was called the Hebrew Home for the Aged in Boston, where I grew up and where she was. And it took her 6 months, but she fought it tooth and nail. But eventually, decided it wasn't that bad. It's not that they have to be horrible. It's just that their image is horrible. And there are some absolutely horrible ones too. All right. So that's all preamble. But the answer is, part of the way they get away with what they do with poor, unsafe environments is they're a mix between healthcare and a residential facility. So we regulate them a little bit like going to somebody's home, but homes don't get regulated very much, right? I mean, when's the last time, even in Philly, if you have, what do they call them, the licensing guys there?
Oh, L&R, yeah, L&R, and yeah.
Out of Illinois, all day long. But you know what I'm saying? That no one's coming to your house to see if it's hygienic or if you're a hoarder or if you're keeping 100,000 cats or whatever you might be doing. So that's an area of very light oversight for a population that's very dependent. I don't think it makes sense, but that's part of the way they get away with it. The other reason is nursing homes are almost always for profit, and they skimp on things like all nursing homes. Again, I don't know how much experience you guys have or listeners have, but they're almost always built for a roommate. It's very few single rooms. Very few.
Right.
If you have an epidemic and everybody's in rooms of 2 and your workforce swings around from nursing home to clean or provide specialized care like a colonoscopy bag or something like that, they're set up to be like little engines of infection. So that's part of the reason they had problems with flu long before.
Oh my God. That's right. It's one of the least reported on issues in American health for me is the numbers of deaths every year from the flu in nursing homes. And it's partly what you say. I mean, there's a lot of people who cater to nursing homes. That is that they do the food deliveries. Mm-hmm. And if you are infected or have been recently infected and you're handling food and you go around to 3 or 4 of these places, oh, hello, I'm the flu bug.
Yep. We were talking earlier about masking, and I masked on my flights to go to UAE. Mm-hmm. And I've still been a little leery of going to the movies, for example.
Oh, yeah.
I know people are doing it, but they're streaming and you can sit at home, and I don't really see the need to go out there with some risk factors. But the risks I'm talking about include the flu, John. It's not just COVID. I mean, There's a lot of people got the flu right now as we speak. There are many people who have COVID right now as we speak. And I would just say, boy, you shouldn't be going in a nursing home to visit your loved one unless you wear a mask. And I wouldn't let you inside a children's hospital without a mask, or a neonatal unit where the kids really don't have much immunity, the newborn babies, preemie babies, they're, and all the nurses and everybody's masked up there. It's not an accident. They know. So when somebody like DeSantis says, well, I'm against all mandates, I just think that's stupid.
In the couple of minutes we have left, Art, there was something else that you were talking about that I found interesting. You were the co-author of an article, Are We What We Eat? The Moral Imperative of the Medical Profession to Promote Plant-Based Nutrition. So you have thrown your hat into the vegan ring, I guess.
Yeah. And this is, boy, it generated up some heat on this issue. So I have a former student of mine, actually, who went to the University of Pennsylvania when I was there. She's now a growing star cardiologist at Yale. And so not far from where I live in Connecticut. And we've stayed in touch. And she said, I'd like to write something about the fact that I don't think doctors push plant-based diets or vegetarian diets or healthy diets as much as they should to their patients. She means primary care. She's not talking about, by the time you see the cardiologist, a little late for that. But so she's just saying maybe we should promote that more. And would you write an article with me about that? And I said, well, her name's Sarah Hall. I said, Sarah, I would, and I think it's right, but I'm not a vegetarian. So we've got to put something in this paper acknowledging that it's better to do it, but, not everybody has made it there yet. She said, that's a good idea because many of the doctors who would be promoting better diets may not be up to snuff. So I mentioned this because what we tried to say first was the evidence for plant-based diet for health, forget about environmental impact, it's pretty strong. I mean, you just do better for many diseases the more you can kind of go over to vegetables. And that seems to be the argument that then doctors should spend more time talking about this, trying to encourage it. But what I contributed was, and the goal is to try and get you to shift or improve. You don't have to become a purist. I know I eat dinners with many people who are vegans and vegetarians, and they somewhat lord it over the rest of us as to their morality. I don't think that's the right attitude to change those of us who are showing up at barbecue joints. It's you're not gonna. But what you want to do is say, have one or two more meals that are plant-based. Try to avoid bigger portions of meat. Substitute in other side dishes, and I do try to do that. And I think that's a good message. I guess in healthcare, what you learn if you watch people for a long time is there are very few people who achieve the optimal. What you're trying to do is just to get them to do a little better. And you get that done, and that's pretty good. I'm okay with that. Somebody says you should lose 50 pounds, Art, and I managed to lose 15 and keep it off. I'm good.
So there you have it. Art says, add more vegetables to your meal. Art, thanks again for being with us today.
It's fascinating.
Yeah, good luck in the United Arab Emirates, and hopefully...
what my last job will be? It'll probably be as an agent to arrange tourism for rich people to United Arab Emirates. Somebody's got to be the middleman there, right?
You're going to clean up.
Clean up.
As you said, we're all capitalists. Thanks, Art.
Thank you, guys.
And thank you for listening to the Musical Innertube.
The Musical Innertube is available everywhere good podcasts are found. Listen on your favorite platform and give us a good rating.
You can subscribe to the podcast on our website, musicalinnertube.com.
There you can listen to all of our podcasts, see pictures and biographies of our guests, and contact us. You could even leave us a voicemail.
And don't forget to leave your email address on our Talk to the Two page on the website, and we'll send you a preview of who's coming to talk with us by email, just so you're prepared.
That's musicalinnertube.com.
And as always, thanks to virtual band Car Radio Dog for our theme music.